Okay, so this is going to be an introduction to this course. This is a 2-unit course. It's really designed for both the practicing clinician who wants an update on psychopharmacology and also for graduate level people in training. It's going to have a large clinical focus, as I mentioned before. However, we have to have a starting point with some basic neuroscience and biology. And for many of you that are watching this course, taking this course, you will have had an exposure to this in terms of biology in college, maybe in graduate school, physiological psychology, but some people, it may be many years since they have taken coursework in this area and may feel somewhat unfamiliar. I'm going to try my best to explain things in plain English, and I'm also going to be focusing on those aspects of the nervous system and the functioning of neurons, the role of neurotransmitters and so forth, not in a broad scope, but focusing on those aspects that are relevant to understanding both the pathophysiology or the underlying medical cause of some psychiatric disorders and also how medications work, the mechanism of action of drugs. So this first part of the course for many people may be somewhat unfamiliar. It may feel somewhat intimidating at first, but my experience has been after we move through material again and again and again, even people that are relatively unfamiliar with the biology piece of this are going to start to feel more comfortable with that piece of it. So that represents really about 20% of the course. But then the 80% that follows is going to be very clinical and applied. We're going to be looking not only at just drugs, but we're going to be looking at a number of issues that are very relevant to this. A course that just talks about drugs and side effects can be awfully boring and not very useful. So we're going to be looking a lot at diagnostic issues. First and foremost, the effectiveness of any kind of treatment, whether it's medical treatment, psychotherapy, or what have you, rests on accurate diagnosis. And you better believe me, there's a lot of inaccurate or inadequately dealt with diagnostic procedures that are done out there, especially in primary care where the physicians do not have a lot of time to really spend with their patients. So we'll be looking at diagnostic issues. We'll be looking somewhat at the underlying neurobiology to make sense of how the medications work, and then focusing, of course, very specifically on various classes of medications, talking about what to expect in realistic terms, looking at potential limitations and side effects. And in particular, we're going to be looking in many areas at large-scale empirical studies. These have really come about in the last 5 years, and I would say probably 98% of what I'm going to present to you has nothing to do with any personal opinions that I have. Plenty of people in this area have personal opinions, and that's okay. But I think for a course like this, what makes the most sense is to talk about the current status with regard to these large-scale studies that are not driven by personal opinions or even consensus, but they're empirically derived studies based on treatment outcomes of thousands of patients. So, as we get launched with the course, there will be some reading material for you to take a look at. There are 4 chapters from books which are reprinted. I think it would be a good idea to read those in the early part of the course. The book on medication adherence is one of the best that I've found. It's very reader-friendly, it's very compassionate, and it's an important part of understanding the art of psychopharmacology, because the bottom line is many people that take psychiatric drugs end up stopping taking medication or take it at low doses, and there's lots of reasons for this. They're afraid of addiction potential, they have side effect problems, many legitimate reasons that people don't take the medication. The skilled clinician needs to develop the ability to really understand the nature of compliance issues, and not like a technician who hands out pills, but a psychotherapist who deals with the complexity of this kind of treatment, the fears that people have, and also to be able to work in a collaborative way with the primary treating physician, whether it's a psychiatrist or primary care doctor. And then finally, there is a book. I'm one of the authors of the book. It's a very easy read, short book, clinical psychopharmacology book, and I would recommend that you read the chapters in that book that correspond to the lecture. There will be a little bit of redundancy, but I think that that's going to be helpful to not only hear the lecture and the PowerPoint slides, but also in the reading. And then finally, throughout the course, you'll have the opportunity to take an exam over the material that you have been exposed to. The exam is going to be multiple choice and a few true and false questions. No trick questions, but questions that do certainly try to measure whether or not you've been paying attention and grasp the essential elements. One final thing that we're going to do, at least partway through the course, are take clinical case vignettes and walk through them and to try to get an idea about the nature of thought processes that really need to be used as we try to evaluate complex comorbidity. Lots of textbooks talk about the ideal patient or what you should do under normal circumstances, but normal circumstances in clinical practice are people who have a whole host of personality problems. They may have comorbid substance abuse issues, medical problems, and so forth, plus a whole range of attitudes about medication treatment and so forth. So we will not only look at this from a kind of a didactic perspective, but I hope to bring in a number of clinical issues that really reflect what's going on with real-life patients. And plus we'll have a few interesting videos along the way. So I hope that you'll enjoy the course. I hope it's going to help you increase your ability to accurately diagnose patients, to increase your ability to effectively communicate with primary care physicians who in fact are doing the majority of prescribing of psychiatric drugs in the United States, but also with psychiatrists, and to learn the language of collaboration, because we're all in the profession of trying to reduce human suffering. And oftentimes our best shot at being able to accomplish that is by using integrative approaches, which bring together things, of course, like psychotherapy, but also the role of exercise, diet, in some instances, bright light or high intensity light therapy, and psychopharmacology. Okay, so welcome to the course.